Okay, so hi, this is an example of the AMP2 Viva, which is a 30-minute exam. The first thing we're going to do is just ask you some questions about the case study that you've got. You got the case study about 6 weeks ago, and you've had 10 minutes prep time to read through your notes. So the first question I've got is that you've got case study number 2.
Yeah.
This is the chap who's got the painful stiff shoulder. Can you tell me what pathologies might be present that would give you a painful stiff shoulder?
So you could have adhesive capsulitis, also known as frozen shoulder, impingement. After surgery, you can have stiffness within the shoulder, osteoarthritis.
Okay. How common is osteoarthritis in the shoulder? Do you know?
It's not as common as the other joints in your knee.
And when you say impingement, what kind of things are being squished or impinged?
So it's it's between the acromion and the rotator cuff, and the subacromial space in between gets compressed, and that can cause the stiffness and pain.
Okay. Do you know what the two categories of adhesive capsulitis are?
Primary and secondary.
Okay, and can you tell me a bit about each of those?
Primary is if they've had just like Melody, the case study, she's had no surgery, so it's just come on from nothing. And then a secondary case of frozen shoulder would be maybe if someone's had a previous surgery or a dislocation to the shoulder, it can make it more apparent.
Okay, fine. And can you tell me what the stages of a frozen shoulder are and what the signs and symptoms associated with those stages are?
You have freezing, frozen and fawning. In the freezing stage, they start to get pain on the night time, but sometimes it can be classed as a painful mobile shoulder because they can still get a bit of movement as seen in the case study.
Okay.
And then the frozen stage is when the pain gets a lot. It could start even waking them up in the night and they can't move it at all. It is frozen. And then the fawning stage is when they're getting back to normal and the pain's reducing and they're getting the range of movement back.
Roughly how long does a frozen shoulder last?
It can take up to about 12 months to 2 years.
Okay, fine.
It's different from people.
Okay, fine. Just a question about red flags. What kind of red flags might be relevant to a shoulder that you might be needing to think about?
If the arm is stuck in medial rotation, it can sometimes mean that a posterior dislocation has happened and that can trap the axillary nerve, so it can cause additional complications.
Okay, and what is a red flag?
A reason why we wouldn't do treatment.
Okay, fine. Are there any other red flags that might give you pain in the shoulder? Any other conditions or diseases that might present as shoulder pain?
Possibly cancer, so like a malignancy, tumour in the shoulder.
Okay. What about which internal organ might give you shoulder pain?
Your posture. I was going to say your posture, but it's not your
Bum bum, bum bum, bum bum.
heart. Sort of circulation.
Okay, so we've got the model. I'd like you to treat Adam as though he is your patient, please. First of all, can you palpate the coracoid process for me?
Hi Adam, I'm Olivia, I'm your student physio and I'm just going to be doing your assessment today, that's okay. If you feel any pain or discomfort, just let me know. The coracoid.
Coracoid, please, yeah.
So just see it.
Okay, and can you show me the spine of the scapula?
Spine of the scapula. It's just, yeah, wait.
Okay, where does it start and where does it end? Which is the spine? Is it that or is it that?
The spine of the scapula at the top.
And where does the spine end?
At the inferior angle.
Does it?
The acromion.
Right, okay. Can you name a muscle that attaches to the medial border of the scapula?
Rhomboids.
Okay, and what type of rhomboids have you got? How many have you got?
Major and minor, so two.
Okay. And can you palpate and surface mark and classify the glenohumeral joint, please?
Yeah, so the glenohumeral joint is just there, and it is formed between the scapula and the humerus, and it does 3 degrees of movement, flexion, extension, abduction, adduction, medial rotation and lateral rotation.
And what do you call a combination of all of those?
Circumduction.
Okay, and from the front, can you show me where the joint is?
The joint was just here.
Okay. Can you show me the origin and insertion of biceps brachii, please?
Yeah, so biceps brachii comes from the supraglenoid cavity, which is at the top,
Okay.
and the coracoid process.
Which head's which?
The long head is the supraglenoid cavity and the short head is the coracoid process.
Okay.
So coracoid is here.
Okay, and then where does it insert?
And it inserts at the radial tuberosity.
Okay. Does it have any soft tissue attachments as well?
Bicep aponeurosis.
Good. And what does biceps do?
It flexes the arm, flexes the elbow and supinates.
And what does the long head do to the shoulder?
Flexes the shoulder.
Okay. Okay, so you've asked that. So I'm going to ask you some assessments now. Can you show me a belly press test, please?
Yeah, so Adam, if I just get you to press against your belly, and a positive result would be if the elbow dropped back, and that would be a weak subscapularis.
And what would a negative result be?
A negative result would be if the arm stayed in line, just like that.
And tell me what is a sign of? What would a positive test be?
A positive test would be if the elbow dropped back.
And that would show you that he's got what?
A weak subscapularis.
Okay, fine. Fine. Can you tell me why it does that?
Because the other muscles start to take over, the pec minor and lat dorsi take over.
Okay. What other tests could you do for a subscapularis tear?
You could do the Burhill test.
Okay. Can you show me how you would do deep transverse frictions to supraspinatus? You can sit on the bed for this, Adam, if you like.
So Adam, I'm just going to get you to put your arm behind your back so I can get the supraspinatus.
Ask her what supraspinatus is.
What is supraspinatus?
Supraspinatus is one of the rotator cuff muscles that controls the shoulder.
Ask her what a rotator cuff is.
What is a rotator cuff?
Rotator cuff is a dynamic stabilizer, and it's formed from the supraspinatus, infraspinatus, teres minor and subscapularis.
Okay.
The reason we'd be doing this treatment is to get rid of the pain, and it can break up the fibrous parts of the joint that are causing tendon. Sorry.
Okay. And what do we think deep transverse frictions do to collagen alignment?
It helps put it into an organised structure.
Why is that a good thing?
Because it helps strengthen the tendon so it can take more load.
Fine. And how long would you do deep transverse frictions for if he came to you for the first time?
So if it was in the acute stages, up to about 2 minutes.
And then how many times a week would you want to see him?
Once a week.
Okay. Can you show me, well, while we're here, can you tell me what the contraindications are to deep transverse frictions?
If they have a malignancy, so a tumour, loose fragments within the area, and psoriasis, which would cause extra complications if you were rubbing the area.
Okay, what's the first thing we ever taught you?
Oh, and no consent.
Okay. What happens if he's got an infection and generally feels unwell?
You wouldn't do the treatment.
Okay. Fine. Can you show me a grade 4 PA to the humeral head, a posterior anterior movement?
Yeah. So Adam, if you just want to lie down. And then
Okay, Adam, ask her what she's doing.
What are you doing?
So I'm currently doing a PA glide to help increase the range of movement at the joint and help increase extension, what you're currently limited in.
And what does PA stand for?
Posterior anterolateral glide.
Say again.
Wait. Posterior anterior glide.
Okay.
Yeah.
And why is that a grade 4 that you're doing?
Because I'm going to the end range with a small amount of movement.
Okay. Can you show me an exercise that you would give to your patient
Yeah, so
to either strengthen or mobilise a range?
Okay, Adam, because you've been having a limitation in your external rotation, we're going to use this crutch and we're just going to push out to the side as much as you can. And then we want to hold it for 30 seconds. We'll give it a go. And this stretch will be working on the right arm.
And what specifically is it stretching?
It is stretching the external rotators.
Okay, and you said 30 seconds. How many reps would you ask him to do?
So I would get him to do 3, 1 in the morning, 1 in the evening and 1 in the night.
And are you just asking to do it once for 30 seconds or a few times? Or
5 times each
Okay.
time and hold for 30 seconds.
Okay, so we're going to go to movement analysis now.
Yep.
So I want you to imagine that Adam is doing front crawl in the water. So Adam, if you can lie down and with your right arm start doing the crawl. We've got plenty of time. I won't instruct you unless you need me to, but I want you to tell me how his scapular-thoracic joint is moving,
Yep.
what the movements are, and which muscles are doing it. And if you like, you can ask Adam to break it into stages to make it easier for you.
So the first stage we're going to start off is this. This would be an isometric contraction. Adam is currently elevated and has slight retraction but not much. And then as he goes down, because he's going in the water, it will be a concentric contraction. And if you just stop just a bit, he's gone into depression at the scapula and he hasn't got the retraction anymore, so slightly protracted. And then as he comes into the third stage, he's then retracted again, and it is still a concentric contraction because he is with the water.
Okay. Which muscles are responsible for elevation of the scapula?
Levator scapula and upper traps.
And what the whole rotation of the scapula, so as well as upper trapezius wells, will do it.
Lower trapezius.
Yeah, and one more muscle helps to protract and elevate.
So, not serratus anterior.
Go on. It's not serratus anterior, or it is serratus anterior.
They work as the force couple, but
Is it serratus anterior or not?
yeah, serratus anterior.